Well, thank you. I appreciate you guys coming, and I'm going to move this little thing down because it's in my way. Welcome to the 2014, I guess, open enrollment, and we're really excited to present this, what we've got for you this coming year. My name is Patty Perkins. For you, those of you I have not met, I'm the HR director, and I am just about to celebrate my first full year with the city. I arrived about this time last year, and one of the very first things I participated in was an open enrollment session for a whole benefit program I had no idea about. So I feel a lot better this year, having got a full year under my belt. We have a couple of folks I want to make sure that you know who they are. Christina Barney, wave. Christina Barney is our benefits coordinator. Some of you may know her. We are so lucky to have her, and I will be giving her kudos throughout this presentation because she really has worked so hard in developing a good benefit platform for us, getting a lot of systems and records and everything a lot more streamlined and organized. This time next year, you'll be able to, we won't have paper forms for you. You'll actually go online and enroll. We're so excited. We can't stand it. Coming into the 21st century, what a thought. And, but Christina's really done a great job. And I want to also introduce to you Laura Lee Berg. She's one of our HR generalists in the office, and both Laura Lee and Christina joined us during this calendar year. Christina joined us in January, and Laura Lee came in March. And then our final guest is Lois Morris, whose name is on this presentation. She is our consultant with Mercer. Mercer is the broker that we've used for a number of years, and really it would be almost impossible for us to bring you these benefits without their assistance. It really does help to have an expert in the field, so thank you, Lois, for everything that you've done. I hope you know that the city is very committed to providing a very full and generous benefit program. We have been very fortunate in that we have been able to remain quite consistent with our benefits over the years and not had many changes to the plan design. Unfortunately, as we'll talk about in a little bit, this year is going to be a bit different. We have had to do some plan design changes, and I want to make sure that you all understand exactly what they are and how they are going to affect you. They're not as bad as you might think, but there will be some changes that we'll talk about. And we've had some reasons for that. I have to make sure I can make this work. Is that, yay! We have had a couple of major factors that impact our need to make some plan design changes. The first one is the experience rating, and what that is just like when with your own car insurance, if you get a ticket or you have an accident, or your homeowner's insurance, if you break a window. I live by a golf course, so that happens occasionally, and you actually have to put a claim into your insurance. That the next year you're probably going to pay a little bit more. Well, that is exactly the same thing that happens with health insurance. And so they look at the pool of claim experience for the city, and they make a determination based on how we have performed over the previous 6 months or 12 months, and determine in part our rates for the coming year as a result of that experience rating. And we happen to be in an uptick with our experience rating, And that we had kind of the perfect storm this year. That, coupled with the Affordable Care Act, also known as Obamacare, has really created a situation where our renewal percentage was very high. And in order to bring that down to a more reasonable, cost-effective level for both you and the city, we needed to introduce a few changes that we'll talk about. But part of what goes into the experience rating is not just the catastrophic kinds of usage that happens in any employee population on occasion, but it has to do with the habits that the employees that are using the insurance have developed over time. So the city has really always had a very, very generous program that allowed access at a lot of different levels for care. And as a result, we probably have people going to the emergency room when maybe going to an urgent care would be a better choice. It would be a more cost-effective choice. And so part of what we are trying to do is to make you really good consumers of your health benefits. And that, quite frankly, is consistent with where health benefits are going nationally. It really is going to a more consumer-driven program, which is kind of the basis on which the state exchange is developed. It's really, you get to look at all these different options and choose the option that fits you best. We'd like to see the city move to that type of a thing, not the state exchange per se, but a more consumer-driven, option-laden plan. We're not there yet, but part of what we want to do this year is to get you thinking that way, so that you are utilizing your health benefits in the best way that is for you and the most cost-effective way for you as well. Another thing that drives the experience rating is medication. And we are very thankful to be living in this time. We have a lot of medications available to us that allow us to live with some very difficult chronic medical conditions. However, the cost for that is very high. Many of those drugs are thousands and thousands of dollars in a month, and some of you may know that personally. Some of the biologic medications that you take by injection once a month for RA, they're extremely expensive. And all of those costs go into increasing our experience rating and the overall cost of health care. So what you're going to see us talk about is really an emphasis in wellness and preventative care, so that over time we can manage that experience rating and not have it keep climbing. And we want to make sure that you, as employees and consumers of health care, are able to prevent conditions that you may have in the past, in the future, and not have to access health care at such a high and expensive level. Just so you know, 5% of our overall increase this year is courtesy of the feds. And I'll just be clear. It's a pass-through cost to Blue Cross from the federal government as a result of the implementation of the Affordable Care Act. So I will tell you that when we started to look at our renewal, we thought, we were looking at doing some integration of our wellness program into our plan design, which we have done this year, and you'll see how that works. But we thought that we wanted to minimize the change to all the employees by staying with the same provider, Blue Cross, that we've had. Well, they came out to us and said, well, thank you, that will be 18% increase. And that is a huge increase. It's the highest increase that we've ever been presented initially. Thanks to Mercer, we were able to negotiate that down, but only 2% to 16%, which is still very, very high. So because of that, we really needed to look at some additional things to do to bring that overall increase down a bit. And we have done so, and our overall increase is 11% this year. It still is the highest increase that we have had in ever, maybe. I don't know. Lois? At least 10 years? Yeah, so it is that's an increase to the city's overall costs, and will be passed along to you as well in your dependent coverage care costs. Those are all, it'll be slightly higher, 11%. So that's the bad news. And I want to kind of tell you how this is going to be looking this coming year and what the plan design changes are. The very first bullet up there, I don't want you to have a heart attack as you're looking at that, but we are going to institute for the first time an employee premium for coverage of just the employee only. Before you get too panicky about that, there's really some easy ways for you to reduce that through 2 different discounts that we'll talk about, so that you will pay nothing. But it is important for us to start setting the stage for your consumer-driven ideas, and this is part of giving you some incentive to make some healthy choices, and you can reduce that employee premium back to 0. The other changes that you should know about is that we did increase the deductible this year, and I know we've done that a couple of years ago, but we went from $500 to $750, so it's another $250 a year on an individual, and then a corresponding amount on the family deductible as well. There is a corresponding increase to the out-of-pocket maximum to accommodate that increased deductible. So there's an increase there as well. And then there is a slight increase in the office copay from $20 to $25. There is now new this year, a pharmacy out-of-pocket maximum. And that may not sound like a good deal because that looks like a real high number, but there never was a cap on it before. So this is actually a good thing. So it doesn't increase anything that you're already going to be spending, but it does limit, if you have regularly spent over $3,000 in a year on your medication, it will cap out at that, which it never did before. You could have spent $10,000. So that's actually a really good thing. There are no changes to the prescription drug copays, and the city is still committed to defraying a good portion of your dependent care coverage, and so we're still covering 80% of the cost of that. Preventative care services are still 100% covered, and even though there's a higher out-of-pocket max, it's important for you to know that your deductible, your co-insurance, and copays this year, which hadn't counted in the past, but copays this year will all count to meeting that higher out-of-pocket. So while it has gone up a little bit, it'll be easier for you to meet it because of the copays being counted towards that out-of-pocket maximum. The co-insurance is the piece that you pay after the insurance pays at 80%. So it's your 20%, and that counts towards that out-of-pocket max as well. So here are the changes and the plan design for the health insurance that I just went over. And the first line under the titles talks about the premium and discounts for wellness participation and non-tobacco usage. And we'll talk a little bit more about that, but those are those discounts I was referring to. The higher deductible, the co-insurance, out-of-pocket max, the office visit co-pays, and your annual maximum is unlimited. Years ago, it used to be $1 million, or that was a lifetime max, but we used to have maximums associated with health plan usage. And then the prescription co-pays are all the same. So I mentioned that we are very interested in integrating our wellness program into the plan design. And the reason for that is that if we as a city are able to over time impact that experience rating, everybody wins. We won't be charged more, you won't be charged more, you'll be healthier, and that is really what our aim is. We are really looking at not trying to police you into and restrict your 32-ounce sodas like they did in New York City. That's not what this is about. What this is about is really encouraging you to make some healthy choices. If you choose not to, you have that freedom. No, but we want to provide some incentive for you to do that. So we will provide a premium discount if you participate in wellness. And participation is defined as simply getting your biometric screening done. And we will provide 5 different opportunities on site at various locations throughout the city for you to do that. We want to make this as easy as possible. It costs you nothing except for your time, and it will provide you the information that you need to be a better healthcare consumer. You can't fix what you don't know. You can't make good healthy choices if you don't know your numbers. And so that's all we're asking you to do. We don't want to know your numbers, but we want you to know your numbers. We will give you the on-site option, or you can go to your own doctor, and we'll just ask you to make sure that you fill out an affidavit and the doctor certifies that they did your biometric screening. And if you do that, you'll get a $15 discount off the $40 premium. So part of what we want to do with this biometric screening is aggregate the data. Blue Cross is our health and wellness partner in this. They have a separate division that runs a wellness program, and we made some changes, and I want to give kudos here to Christina because she has got some great background. She's been in this kind of a role with a different city in California before, and so she has run a wellness program. So she really came in and really has the expertise to administer our wellness program. So we were able to make some changes, and we opted to go with Blue Cross since we've already got a good relationship with them on the insurance side. And they have provided some amazing resources for us in the form of a customized city website, and will really help us with this overall managing of the employee health. And what we do with these, St. Luke's is actually going to do the biometric screenings that we have on site, and then you'll have to agree and sign a release that they can provide those biometric numbers to Blue Cross. And Blue Cross is covered by HIPAA, and so is St. Luke's, and so are we. So we cannot identify who's got what number. So that's not what this is about. It's really about getting aggregate data from Blue Cross. And the reason that we want to do that is that we want to know if we've got a high population of people that have high cholesterol, we will focus more resources and education around that. If it is, we've got a lot of pre-diabetics, we'll focus more education and resources around that. So that's what we will use that for. But there is an option if you're not comfortable with participating and having your numbers aggregated. you can opt out, and it'll just be an affidavit that says, I got my biometric screening, but I'm not sharing it. And again, we don't look at the numbers for anybody in particular. And as I said, I don't want to know your body mass index, and I don't want you to know mine. So we're not going to share those numbers. In terms of the wellness program, we will still be doing the incentives based on participation so that you can earn points for a day off. So that'll happen again this next year. And I think that we're trying to make this as easy and interesting as possible. And we had a great event just this last week. We did a salsa contest. Y'all missed something really good if you missed that. We had how many? 12 participants, and wonderful samples, and it was really fun. It was a great event. And so we've got a lot of fun things planned for this next year. The other way that you can discount off that employee premium is being a no tobacco user or a non-tobacco user. The city has a no tobacco use on city property policy, as you know, and so this fits with that. And I think it's pretty common knowledge that people who use tobacco products tend to be sick more often. They have more sick days. They also have a higher use of the health care insurance programs. So it makes some sense, again, to encourage healthy choices. If you do not want to stop using tobacco, that is perfectly fine. You just will have to pay $25. If you don't use tobacco, or if you want to quit using tobacco and you sign up for a tobacco cessation program that you would finish by March 31st of next year, you will have a discount of $25 on your employee premium. So between wellness participation and the no tobacco piece, you can retain your zero premium on your employee health care. If you do pay a premium, it is pre-tax, so it does have the effect of reducing your taxable income. So it's not quite as bad as it might sound. We are going to ask you to sign an affidavit of whether or not you were a tobacco user or not. And that actually is attached to your benefit summary that you have in your hand, and it's also available on the HR benefit intranet site. We are using, to define tobacco usage, we are using the definition under the ACA, which is the use of tobacco 4 times or more a week within the past 6 months. So as I have said to some other groups, that occasional cigar on a golf course or in the evening is not going to prevent you from saying you are not a tobacco user. It's just really if you use it consistently. And then once you go through the smoking cessation, if you can meet this definition, the next open enrollment, you can say you're a non-tobacco user and get the discount next year as well. And I think it's important for you to know that we're not going to test for this. So this is an affidavit. It is really, an affidavit is a legal document that says that you attest that what you're saying in the document is true. So we're going to trust you on that. And, you know, this isn't about us being the police to catch you doing something bad. It's really, the whole point of this is to encourage you to do something good for yourself and quit smoking or quit using tobacco products. This is an eye chart that is really hard to see, but we'll have all of this information available for you on the intranet. But this just kind of goes through the various tiers to kind of show you what the differences in the premiums are going to be. So the very first block is a non-tobacco user and somebody who is wellness compliant. And you can see under that says premium discount $40. So that person will pay nothing for their employee coverage of their benefits. The next tier down is somebody who is a non-tobacco user. However, they decided not to do the biometrics. So they'll get a premium discount of $25. And if you look all the way over to the right-hand side, the employee monthly contribution will be $15. Somebody who is a tobacco user but they're wellness compliant will pay $25. They get a $15 discount. And somebody who is a tobacco user and also opts not to participate in wellness will pay $40. Again, pre-tax contribution. And when we did the modeling, I think it's important for you to know that we're not doing this for the money. The money that anybody does contribute will go back into the general fund and really will be used to defray the cost of the benefits overall. But we modeled this when we looked at it at about 20% tobacco usage, and the amount that we would get during the course of a year is only about $20,000, which sounds like a lot of money, but when you consider we're paying over $4 million a year for the health benefits, it's not that much. So this is really, again, to help you, give you some incentive to make healthy choices. To further give you some insight into how this might look for you, we've come up with a couple of different scenarios here. In the first one, this is an employee that has health coverage for themselves only. Employee participates in the wellness program and is a non-tobacco user. And so the health premium would be $0. So again, just kind of reinforcing in a different way the eye chart that I was showing. In the second scenario, this is an employee who just covers themselves and does not participate in wellness and is also a tobacco user. So they would pay $40. In the third scenario, an employee has health coverage for themselves and their family, and the employee participates in wellness and is a non-tobacco user. And so that monthly premium would be $161.96. In the fourth scenario, the employee is a tobacco user and non-wellness compliant, and that person would pay for themselves and their family $201.96, $40 difference. So just shows you how that will look. Yes, sir.
I have a question about, so on the people that are covered, say you're a family member, or your family members are covered, and they're smokers,
Mm-hmm.
you're not. So how does that make it work?
You get to sign the affidavit saying you are a non-smoker, because we are only applying this premium to the employee. So at this point, and even though we know that family members who smoke or use tobacco products also impact the experience rating, our relationship is with you. And so we're not delving any deeper into your family's personal life. But what we hope is that if you model really good behavior, that they'll come along with you. So that's what we're hoping. That's a good question, so thanks for asking. Thank you. Vision Service Plan. This is really no change to this plan, and the benefits and the copays and all of that kind of good stuff are all the same. However, this year you're going to see a separate deduction for that. It used to be kind of rolled into the premiums and the coverage through Blue Cross, but we are now kind of dealing directly with VSP. So you're going to see this on your check, and you can see it's just an eensy little bit. If you're an employee, you don't pay anything. But if you're covering a spouse, it's 85 cents a month. So it's very inexpensive insurance, which is why it doesn't cover as much as some people would like. So, but it's a little help. So, Delta Dental did not increase our rates this year. Yay! So we've got the same kind of benefits this coming year as we do the current year. So that's all really good news. Willamette Dental is the other dental option that we have offered, and for folks that have orthodontia needs for themselves or their families, primarily are the folks that choose that. And that did go up just slightly, 3%. And here's a look at both contributions and what that will look like on a monthly basis. And then finally, I want to talk to you a little bit about the flexible spending account. We have two different types. We have the dependent daycare and the medical flex accounts. On the flex accounts, these are pre-tax deductions and that you can use specifically for those two categories of expenses that you have. And in the medical flex spending, that money is made available to you, whatever you determine for the whole year. That money is available to you up front. And then you can use the debit card, or you can do a reimbursement depending on your preference. And you can designate up to $2,500 to go into that flex account. That money can be used for deductible, co-pays, pharmacy co-pays, anything for glasses and so forth that isn't covered by the vision insurance. So really any kind of medical expense can be is eligible under that program. And for this coming year, we're doing something a little different that I think that you'll like. As you may know, that flex accounts have always had a use it or lose it feature to it, and that is part of how these things are structured through the IRS. They have allowed us now to allow some rollover money into the next year. You can roll a maximum of $500 into the next year's plan if you don't use all of the money that's designated. And that should help you with that last minute push at the end of the year, trying to use up that last $100. And sometimes it's really hard to estimate exactly how much you're gonna need in a given year. So this gives you a little bit more wiggle room there. And you can go ahead and designate another $2,500 that next year. And however, you have to use up to $500 because you can only have an extra $500 in any given year. It does not accumulate. So if you use if I rolled $500 into 2016 and I designate contribute another $2,500, so I have a total of $3,000 for that year to use, but I only use $2,000, I am going to lose $500 because I can only roll $500 into the next year. So it's not a perfect solution, but it does help a little bit.
But this year's cannot roll into next year.
This year's cannot. This will start for next year. This slide just shows you the additional benefits that are available to you, and the Employee Assistance Program, the company-paid life and AD&D, and short and long-term disability are benefits that are completely paid by the City of Meridian, and they are very valuable. I will tell you that not every employer offers short-term disability. Idaho's one of those states that doesn't require it, and it's a choice that we provide it for you. So it's a very valuable, both of the short and long-term disability are very valuable because, quite frankly, you've got more chance to be disabled and need long-term disability insurance than you do life insurance. And then we also do give you the option to purchase more voluntary life and AD&D coverage at your cost. So we will continue to do that. And these insurances really have not had any additional, all of these are pretty much, with the exception of the EAP, are through United Heritage, and we had no increase in premiums from them. And I don't think the Employee Assistance Program went up either. If it did, it was just teeny. But in any event, it's paid. Annual enrollment details. The official annual enrollment period is going to be October 27th through November 14th. We need the forms that you were given. We need those returned no later than November 14th. You should consider this is the time that you make changes to your coverage. You can buy more voluntary insurance. You can reduce voluntary insurance. You can add people during this open enrollment time. The only other time that you have available to make changes is when you have a qualifying life event. And that would be if you get married, divorce, you have a child, you adopt a child, you have a change in employment status. Those are very limited situations that would allow you to make changes mid-year. Otherwise, whatever you elect, you will have for the entire year. And you, if you're not making any changes to your insurance coverages, you don't have to fill out any forms. It's a passive enrollment. We will roll you over, so to speak. And but we need to know that, and that's what that form is. We want to make sure that we just didn't miss something from you, but that you intended not to make any changes. If, however, you are a participant or want to be a participant in either of the flex accounts, you must re-enroll every year. And there's your, you have to go to the benefitmanagersco.com website to enroll, and that's what you will need to do. And as I mentioned, we'll need all of your forms turned in by November 14th. Let's see, what else am I missing? Anything? Beneficiaries, you want to look at your beneficiaries. This is the time to do that. Although you have some flexibility in changing beneficiaries mid-year, that's one thing you can do. But this is a really good time just to make sure that you have the beneficiaries lined out the way that you want. And I believe, more information. I know this is what I wanted to say. Christina has done a fabulous job in updating and maintaining current information on the benefits site. I know that hasn't always been the case. It's she happens to be very skilled at that and very focused, so she does a great job. We have some new resources out there for you this year. In addition to all of these meetings, there is a new benefit guide that you can look at online or download in print as you wish. That gives you really good summaries. And then if you want a lot of detail, all the summary plan descriptions are out there on the intranet. In addition, we have, Christina's worked with IT to build you some calculators so that you can play with various levels of coverage, and if I'm a smoker, what's going to happen. So you can look at exactly what you can expect to happen to your premiums next year. And so there's no surprises when you get your first check in January. And this is where you go to the intranet and you go to Human Resource and to the Benefit tab in Human Resources to find all that information. As I mentioned, we're recording this particular presentation. in case somebody couldn't get to some of the open enrollment meetings. So just let people know that this will be uploaded. Probably takes probably tomorrow it'll be up there. It takes a little while to get it uploaded. But we want to make sure that people have access to as much information as possible. Do you have any questions? Anything I can answer for you? Anything from Laura, Christina, or Lois?
So it's always a pleasure to be here. I've done a lot of these meetings in the past, and I feel like, again, I just want to put a little plug in as an outside party working with multiple clients that we did work hard, and it's been a long process this year getting to this point. Maybe not the ultimate feeling for employees, but really very competitive package. And with the premium increase to employees, we still felt like it was a very fair option. And even if you're assessed any part of that $40 for adding that, if you cover your dependents, a $200 premium, you guys, let me just tell you, for a family is almost unheard of in the market. And so my message today would just be that I really hope that you value what they have tried to maintain and given you in the past, but also going forward, we're still pretty pleased with the way things turned out. We hope you are too.
Thanks, Lois. I appreciate that. This was difficult, and nobody likes changes to employee benefits. And my experience is, even if you do a whole bunch of good changes, you have a group that doesn't like it. It's just a really hard thing to do, and we really did try to do the very, very best we could given the circumstances for you, and really prepare us for how we want to kind of move in the future. We really want to be giving you guys a lot more control and options in future offerings, but it'll take a little while for us to get there. But you've got to be educated along the way as well, because this has been a very steep learning curve for me. I've had a lot of exposure to benefits, but I've never had responsibility for benefits like I have here. So this has been, Lois has been a great help. So do not hesitate to contact any one of us in Human Resources if you have any questions. Christina is the super expert, but Laura Lee, Crystal, and I will certainly field any questions that you might have. We know where to get the answer. So we appreciate your time, and I think we're good. Thanks.